Bipolar disorder, also known as manic depression, is a mood disorder or a mental health disease that is characterized by large changes in mood. So if you have bipolar disorder, you may experience mania, in which case you are extremely excited, very happy, euphoric. You may have flight of speech, rapid speech. You may go on big spending sprees, have inflated self-esteem. And then your mood may shift to a depression, where you have low energy, feelings of hopelessness, extreme sadness. There are two types of bipolar disorder. There's bipolar 1, where you experience manic episodes and you almost always experience major depression and hypomanic episodes. And then there's also bipolar 2, which Mariah Carey has. And in that case, you have at least one episode of hypomania, which is very similar to mania, only less severe. And you also experience at least one major depression, but you do not experience the full-blown manic episodes. So what causes bipolar disorder? Well, we believe that it's caused by a chemical imbalance in the brain, although we have not pinpointed the exact cause. We do know that 1 to 3% of the world's population has bipolar disorder, and most patients are diagnosed between the ages of 15 and 30. So what are the symptoms of mania? If you have mania, you may experience excessive happiness, euphoria, lots of energy. You may have rapid speech, flight of speech, a stress to keep on talking, where you may get annoyed if people interrupt you. You may also have an inflated self-esteem, delusions of grandeur, where you feel like you can do anything, you can take on the world. If you have mania, you may set unrealistic goals. You may start project after project after project, set goal after goal after goal, but then you don't accomplish any of them. You also may have a decreased need for sleep, where you're just awake for days and days. You may find yourself being more irritable, where you're snapping off on people or getting angry. You also may be impulsive, where even if you're a person who is normally frugal or fiscally conservative, you may all of a sudden start making really big investments or going on these huge shopping sprees. You may have just a really big difference in your judgment. If you are a person who is typically monogamous, you may all of a sudden be hypersexual, where you're just sexually indiscriminate and just sleeping with some of anybody, when it's not your baseline. So what is hypomania? Again, hypomania is very similar to mania, only less severe. Depression. If you are depressed, you may have symptoms of low energy, excessive fatigue. You may not be interested in the things that you used to like. If you're a person who loves to shop, you're not interested in shopping anymore. If you love to go to games and watch sports, you don't want to go to games anymore. If you're depressed, you may have a change in your eating habits, which can cause excessive weight gain or excessive weight loss. You may have a change in your sleeping pattern, where you have insomnia and you just can't get to sleep, or you may have hypersomnia, where you sleep all the time, you don't want to get out of the bed. You may also have feelings of hopelessness and even thoughts of death or suicide. Many patients with bipolar disorder have a hard time maintaining interpersonal relationships. They have a tough time keeping jobs. They can often go into financial ruin. And over 60% of patients with bipolar disorder abuse drugs or abuse alcohol when they're not managed properly. So why wouldn't bipolar patients be managed properly? Well, it's largely because, as a society, we tend to stigmatize bipolar disease. We stigmatize mental illness. I've heard so many people just make jokes about bipolar disorder. They'll say things like, dude, he's awful, he must be bipolar. Or I've heard people joke amongst themselves and say, girl, you're all over the place today, you must be bipolar. They laugh about it like it's a joke. Yet many people with bipolar disease actually die from suicide. It's not a joke. Think about it. You wouldn't laugh at someone who just had a heart attack. You don't make jokes about people who have cancer. Where bipolar disorder is a real disease. So we should not laugh at it either.